Good evening, everyone, and welcome to our live discussion session. September is Healthy Aging Month, and so this evening's live discussion is going to focus on keeping your vision sharp as you age. I am Prianka Persad, Surgical Services Manager at Trinidad Eye Hospital, and with me are two individuals that are no stranger to our audience. Tonight we have Dr. Zahrid Mohammed, resident in ophthalmology, and our optometrist, Mr. Kareem Kasmally. Welcome, guys. Tonight, we are going to take you through some of the more common vision challenges that are noticed at different stages of life. So we'll talk about from the stage of children to young adults and going all up to the way of seniors. And we'll try to share some practical steps to protect your vision at every stage. So we're going to go right into it, starting off with the childhood and teen years. Many times we find young kids and even teenagers don't often realize that they have vision problems until it starts affecting their schoolwork. So they may have problems seeing on the blackboard or whiteboard, and it may start affecting their sports. So we're going to ask our optometrist, Kareem, what type of issues do you normally see with kids in this age bracket?
Good evening, everyone. So Priyanka, with children, with teens, we see a lot of them struggling with blurred vision, squinting, sitting too close to the TV, going too close to the board. They're copying the notes wrong in class. They're not doing their homework well. They just don't, they're not keen on paying attention in school. And we think they're delinquents. But really and truly, it could often come down to refractive error. A refractive error is something where, or an instance where light isn't being focused on the back of the eyes properly. So refractive errors are things like long-sightedness, short-sightedness, and astigmatism. These are easily corrected with glasses, but oftentimes they go unnoticed until a teacher or a relative or parent picks up on that child squinting or they're not doing well in school. Teens, on the other hand, many of them might say, well, I don't want to wear glasses. I'm looking a bit nerdy. Friends in school troubling them. But not treating a refractive error can cause things to become worse. It can seriously affect learning. It can affect their confidence. So regular eye exams, especially before school starts, is very important.
Yes, and I'm just going to say to those teenagers, make sure you check out TEH Optical to get a nice trendy pair of specs.
Yeah,
But
definitely.
moving to Dr. Mohammed, from a more medical standpoint, what should parents be looking out for in their children in terms of vision?
Right. So, afternoon, everyone. So, apart from glasses, there are rarer serious conditions, and Kareem will have highlighted on a few like long-sightedness and myopia. But you could also have a lazy eye or amblyopia, in which case their vision can become underdeveloped. You can have childhood cataracts if kids are not screened. They tend to be missed very easily. Some points to look out for is sometimes kids may tilt their head a bit. They may cover one eye. They may be holding objects really close to their face in an attempt to see. Similarly, if they're writing, their heads are really literally down on the desk. These things are red flags. And the advice is generally, if there's any complaints from a child, try not to ignore those, especially because they are not sure what they may be reporting, especially younger kids. So it's very important to pay attention, and anything that you may think is a red flag should not be ignored. Regular screening is of course of utmost importance because you want to be able to catch issues earlier before they actually become detrimental to their vision and their progression and development into adulthood. Yeah.
Yeah, so thank you. The key points here being that early detection of the more serious eye conditions can prevent lifelong issues. And then we have those persons in the 20 to 30 age bracket, where most people feel like they are at their healthiest and that their vision is at their best. But what sort of commonly seen problems do you notice, Kareem?
So with young adults like myself, most of us have good vision. I wear glasses. With my glasses, I have good vision. but our lifestyle definitely takes a toll on us. We're on the cell phones very often, we're on the computer very often, our daily life is on a screen. So we staring at a screen probably the majority of the day. And this could lead to dry eyes, it could lead to the eyes being tired, it could lead to us getting eye strain, which will cause us to get headaches. We also see some young adults they abuse their contact lens use. They wear it to the swimming pool, they wear it to the beach, they wear it for way longer than they should. They wear it to sleep. That could definitely cause much more severe issues than just the eye strain. To be honest, it can cause infections, it can cause some cases persons to lose their eyesight if we abuse the contact lens wear. When it comes to the eye strain from digital devices, from excessive near work, a simple guideline that we like to follow is the 20-20-20 rule. It's not a concrete rule saying that you have to follow and do exactly 20, but it's a guideline that tells us, we need to take frequent breaks from devices, from near work. So what it basically means, Priyanka, is that every 20 minutes, we should take a 20-second break and look at something at least 20 feet away, right? Now, it doesn't have to be every 20 minutes. It could be a little bit longer, a little bit shorter. It definitely doesn't have to be 20 seconds. It should definitely be a little bit longer, right? And why we say 20 feet is because when we're looking at 20 feet, the eyes are most relaxed there, right? You could also get up, take a little walk, take a little stretch, get the blood flowing. Right. Together with this rule, or in addition to this rule, we can try using some lubricating eye drops. There's quite a few on the market, some of them for specific patients, for specific types of dry eyes. So definitely consult with your optometrist, with your ophthalmologist before just going to the pharmacy and just picking up a random one. And definitely will follow your contact lens hygiene properly. Listen to your optometrist when they prescribe or when they give you the contact lenses, because these things are medical devices. You don't want to overuse them and you don't want to abuse them and cause you to get any kind of infections and so on.
Yeah, and especially with Halloween coming up and everybody putting on these nice, cool contacts. Dr. Mohammed, is there anything that you think is more serious within this age bracket?
Right. So as Kareem was highlighting, this is usually the age bracket where there's the strongest vision. You may notice there's some small changes over time, such as with presbyopia. That's where you just really need a small prescription to do things like reading fine print, any fine focusing activities. But that's the misconception here, because most patients in this age bracket think they're healthy and they're fine, and any little symptoms that they notice tend to be ignored. Is in this age bracket that you should actually be building your vision towards the future. So, proper diet, vitamin supplements, protecting your eyes from UV light to avoid things like cataracts and stuff setting in. So getting a good sunglasses, that's key here. We have seen cases where patients in their 20s and 30s are diagnosed with things like glaucoma and diabetic related changes, especially type 1 diabetics. Also, if they have a family history, these things should factor into attempting to have your eyes checked regularly and not ignoring what could be very early and subtle changes in order to preserve vision into your 40s, 50s, and 60s. Yeah.
Absolutely. So let's move straight into the 40s to 50s category, where people start saying that they get old, so the vision going to deteriorate as well. So, Dr. Mohammed, during the 40s to 50s, what would be the bigger picture for eye health during this stage of life?
Right. So this is when things like glaucoma and stuff starts to creep in. Cataracts might begin forming. They may begin noticing the things they were doing in their 20s, now in their 40s become a bit of a struggle. This is when annual checks become very crucial. Every 1 to 2 years is actually recommended, but if you have a history of things like diabetes, a strong family history of glaucoma,
Seems like we lost Dr. Mohammed. So while he tries to reconnect, we'll move to Kareem. And Kareem, can you tell us what are the most common issues you face with patients during the category of 40 to 50?
Yeah, sure. So, like you said, this is where people say they're starting to get old. So I always like to tell my early 40s, my late 30s patients that when my grandfather was alive, he used to tell me that 40 is the youth of old age. So the body starts to change when we hit that 40 mark, right, Dr. Mohammed? So
Yeah.
one of the biggest issues that patients tend to go through when it comes to the eyes that we, the optometrists, would be concerned about is something called presbyopia. So presbyopia is basically where as we age, our lens in our eyes is getting denser and denser or harder and harder. And there's muscles that move the lenses to help us focus. Just like a camera has to focus on something near and something far, our eyes have to do a lot of work to focus on something near. So those muscles that move the lenses to help us focus, they also get weaker and weaker. But it's not an instantaneous change, it's a gradual change. So when we hit that 40 mark, we often joke with some people that when they blow out the candles on their 40th birthday, all of a sudden they can't see their phones well again. They have to take it far away from their face to see it. This would happen to everyone once they hit that 40 mark, once they cross that 40. Some people are lucky it happens at 45. Some people are not so lucky it happens at 38, 39. Right? A simple solution would be a pair of reading glasses. But it doesn't mean to say you can just go to the pharmacy or to one of those shops and just pick up a random reading glasses. Because like I said, we don't lose all the ability to focus at once. It's a gradual change. So we don't want to just go and pick up a random one that's magnifying our phone, magnifying print, and then we think we're seeing good, but really and truly we're going to put the eyes under some strain if we do that. So it's very important for everyone when you hit that when this starts to happen to do an eye exam, and that way we can pinpoint, we can select the exact prescription that that person needs. Right? There are special types of glasses, not just reading glasses, but we also have bifocals and progressive lenses that help with seeing far and seeing near, and also seeing the computer screen. So it's very, very important. Getting the right pair of glasses can definitely make a huge difference in one's daily life.
Yeah, I always remember one of the patients saying he thought his arms were getting shorter.
Yeah, definitely. Patients tend to complain. They only come in when when the arm's too short or the arm's not long enough.
All right, so we're going straight ahead, in the interest of time, to talk about the seniors. So we are at the 60 plus mark. So by the 60s and beyond, vision often will play a big role in independence and your new quality of life. So Kareem, what specific vision issues you'd see in the more senior patients?
Yeah. So with seniors, their prescription tends to change a little bit more frequently. Almost all patients over the age of 60 would need a pair of glasses, whether it be for distance, whether it be for reading, or most times it will be for both, for far and near. About probably 90% of the seniors that we see in office tends to need some form of corrective lenses. The challenges with them is that we have to change it a lot more often when they were younger, especially when they were in their 20s and 30s. Especially when you hit that 60 mark, we tend to see things like cataract and other different conditions with the eyes starting to develop. And this will also affect the prescription because the cataracts patients tend to be a little bit more contrast sensitive, a little bit a more difficulty seeing in dim light, so they need a lot more lighting. They have difficulty with night driving and so on. But the good news is that in regular eye exams and with the most updated prescription, it could go a long way in helping a senior person stay independent, stay comfortable. And once we realize that glasses isn't making a big difference and they have cataracts or they have some underlying issues, then definitely we hit them a referral to go and see the ophthalmologist who will then solve the issue or help treat them for the cataracts and so on, and then send them back to us where we can provide them with good glasses to help them with their independence.
And Dr. Mohammed, more serious eye conditions that seniors need to be aware of. So Kareem alluded to the cataracts, but could you just briefly tell us what cataracts are?
Sure. So in this age group, they they commonly develop cataracts because cataracts are age related in some aspects, but you could have cataracts as a result of certain medication use, certain conditions such as diabetes. So cataract is basically any cloudiness that develops in the eye's natural lens. Think of it like a dirty windshield that you can't see clearly from. You could make out something passing, but can't tell what it is. That's how cataracts usually are. Um, the treatment for cataracts, well, the only effective treatment is surgical intervention, but not all patients need surgery. So having a diagnosis of a cataract is not always a death sentence as people want to think about it. It actually is like a 15-minute procedure with really good results. But as Kareem was alluding, having cataracts can be corrected with glasses or prescription. But you also have conditions in this category, such as glaucoma and age-related macular degeneration, which are also quite common. The danger with these conditions, including cataracts, is that they can go unchecked. And then the patients usually present when they have really poor vision in both eyes, which means that they have a history of falls and accidents and bodily injury, but also they have a decline in their independence and they become more reliant on others, which is not an easy thing for most patients in this age to to deal with because they are accustomed to their independence. Um, the important message is that try not to accept poor vision because it's usually easily correctable. It may or may not involve surgery, so that's a fear that most patients may have that they coming in they will need surgery, but that's not always the case. You can actually have correction to good vision without surgery in most instances.
Well, thank you, Dr. Mohammed and Kareem. We do have a question. So the question says, I'm already wearing glasses, but I still feel like my eyes are getting worse. Is this an aging thing or is something wrong?
So, wearing the glasses doesn't stop, if you have an underlying condition, doesn't stop it from getting worse. What I would want to ask that person is how old are the glasses? And then when last they did an eye exam. So I would advise them to come in, let's do an eye exam and see what's going on with the eyes. Maybe the prescription has changed a little bit, right? Maybe it's nothing severely wrong with the eyes pathologically. So maybe we just need to update the glasses prescription and that person can see better.
Agreed. Yeah.
Definitely. So you could go ahead, Dr. Mohammed, sorry.
Oh, sorry, yeah. Sometimes there are underlying conditions, but most instances is as Kareem said, sometimes it's just a small update in the prescription may be needed. Sometimes just advising how to position the glasses depending on their distance of use. So you might find certain activities they see well. Sometimes the ones that they are accustomed to is the one that they fall back a bit. And so it really is up to the assessment and proper consultation, as Kareem was alluding to. Simple things. It's not anything necessarily extreme.
Yeah, and I just wanted to tell that person you could call us at 235-4834 and we could get you an appointment. The next question, are there any vitamins you can take to keep your eyes healthy as you get into your 40s? Dr. Mohammed?
So, yeah, I guess I'll take this one. So there are a lot of eye vitamins now. Initially, eye vitamins were designed to treat conditions like macular degeneration, where they want a high dose of things like lutein and zeaxanthin. Um, it doesn't go without saying that patients who don't have these conditions can take eye vitamins. What they do basically is they decrease the oxidation process and oxidative changes that take place in the retina and the macula. So essentially, you're actually keeping the retina healthy as they get older. And these will be more applicable to patients who usually doesn't have a well-balanced diet. Also, some vegans as well who don't have a good dietary structure, they are recommended for these patients in order to help preserve vision long term. So yeah.
And we could just buy these over the counter and use them.
Yes.
Anybody can
Yeah.
use them.
There are a lot of eye vitamins now, and the pharmacies usually keep a nice stock of all of those. They are tablets, so they come in gel capsules, tablet forms, some are once, twice a day. So it all depends on the brand and the type given by your pharmacist. So just having a little chat with them, and they will show you the whole lines available there.
We do have another question. So this one says, I'm 55 and driving at night is becoming difficult. Is this normal? So Dr. Mohammed
Yeah.
again.
Yeah, sure. I'll take this one. So, there are certain conditions that could cause night difficulty. Cataracts are one, but at 55, we don't really expect this person to have much cataracts. But 95% of the times, glare is caused by dry eye. So, simply just starting some dry eye drops, average about 3 to 4 times a day, but try using it just before you set out in the night, and tends to make a huge difference. The thing with these drops, though, consistency is the key. So once, twice is not going to make much of a difference, but 3, 4, 5 weeks of usage, which is typically what you get out of one bottle, regular usage, has shown to improve glare, especially in nighttime conditions, significantly. So I would suggest this for this person. And then if there's no improvement, well, then we need to check for underlying conditions that may be causing these issues. Yeah.
Yeah, I just want to add to that, Dr. Mohammed, is that also together with the dry eyes, if that person is wearing glasses, the age of the glasses, and then also if the glasses has an anti-reflective coating. Because if they are wearing glasses and they have a somewhat of a high prescription or even a small prescription, but the glasses doesn't have an anti-reflective coating or the glasses is scratched up with the coating or without the coating, it can also affect the night vision. So again, it comes down to getting your eyes tested and let us also assess the glasses if that person wears glasses. Now, if you're not wearing glasses, then yeah, we'll definitely want to check the dryness and stuff too. But we want to assess the glasses that they have.
Yeah, and we do have a dry eye clinic, so again, call us and get an appointment. So that's it for questions. So we're going to start wrapping up. I just want to say thank you again to Dr. Mohammed and Kareem for sharing this insightful set of advice to us. You know, eyes don't come with spare parts, but luckily we have great doctors and great optometrists. So come
Yeah.
check us out, and everybody remember that no matter your age, healthy vision is possible, and it starts with regular screening and not ignoring warning signs. So that said, we hope to see you at our clinics. Have a good night, everyone.